Good morning, everyone, and welcome to CMAP Talks. My name is Michelle Aganloye, and I'm an engagement associate at CMAP. Today's webinar is on responding to a regional congestion surge. And I'd like to first start off by thanking AAA for partnering with us for this session and for bringing this issue to the forefront. We're really looking forward to today's panelists and to the discussion. So I have a few things to mention, a few housekeeping things to mention as you're participating in today's webinar. First off, all attendees are in listen-only mode. So please be sure to use the control panel on your screen to ask questions. You can enter questions directly into the chat box and we'll be monitoring them. In addition to that, this webinar will be recorded. And also we will have a survey at the very end. So please be sure to complete the survey and let us know how we did today. And now it brings me great pleasure to introduce our moderator for today, Nick Jarmusz. So Nick served as the Midwest Director of Public Affairs for AAA, the Auto Club Group. In this role, he manages external affairs, media relations, and advocacy efforts in Illinois, Indiana, and Wisconsin. Nick has been a part of ACG for 14 years, starting as a public affairs specialist, and in that role, he coordinated events, program, and special projects to promote safety among the most vulnerable road users, which are children, teens, and seniors. Prior to joining AAA, Nick worked for the Institute of Real Estate Management, the Naperville Area Chamber of Commerce, and the Boy Scouts of America. Please join me in welcoming Nick. Thank you.
Well, thank you so much, Michelle, and thank you all for joining us today. AAA, the Auto Club Group, is the second largest club in the AAA Federation, and we trace our roots locally here to the Chicago Motor Club, which has represented the interests of drivers and other travelers in Northern Illinois and Indiana for almost 115 years. We currently have approximately 1 million members here in the state of Wisconsin, or excuse me, the state of Illinois. And our goal is to help them enjoy life's journey with peace of mind, whether that's a cross-country road trip or their dream vacation or their daily commute to the office. In addition to our best-in-class roadside assistance and many other member benefits, we are an advocate for safe, efficient, and sustainable mobility, which we see as a quality of life issue for all citizens in the region. We're especially pleased to partner with CMAP on the event today as we share their commitment to regional planning on transportation and mobility issues. And we are grateful to our panelists for being willing to share their expertise and insights with us here today. I'd like to introduce our panelists. They are Laura Wilkison from CMAP, Jamie Simone from the Chicago Department of Transportation, and Heidy Persaud from the Center for Neighborhood Technology. Thank you all. We're looking forward to hearing what your organizations are working on to support travel safely and how COVID-19 has affected your approach. To our first panelist, Laura Wilkison. Laura joined the Chicago Metropolitan Agency for Planning this year as their Deputy Executive Director of Plan Implementation and Federal Affairs. Laura brings more than 2 decades of experience in legislative strategy, policy development, and coalition building to advance the region's plan and other CMAP priorities. Prior to CMAP, Laura served as Vice President of Metro Strategies, where she managed policy, advocacy, and public engagement initiatives for the firm's clients. Please welcome Laura, and I'll turn it over to her.
Great, thank you, Nick. I am excited to share with everyone today some of the work that CMAP is doing. And I don't need to tell anybody on this call that the pandemic has significantly impacted our region's transportation system. And as Northeastern Illinois Metropolitan Planning Organization, we've been actively monitoring and reporting on the travel trends in the region. And so I want to share with you some of those travel trends, as well as some of our thought process and questions that we're asking about mobility in the region. The data that we've been looking at have led to numerous questions that we have to ask and answer and focus on in order to develop a strategy to deal with mobility issues and an equitable recovery in our region. So first, this reflection on where we are now. So what you're seeing here is the travel trends since March. And we're starting to see right now a return to traffic and congestion on our roadways. Overall traffic volumes are still down about 10%, but if we kind of look at each of the pieces here, passenger vehicles were down roughly half in March, and now again appear to be stabilized around 10% below pre-COVID levels. Heavy trucks had the shallowest decrease in the pandemic and has now largely returned to previous conditions. But single unit trucks, which are mostly but not solely delivery vehicles, were down 30%, but now seem to be stabilized 10% above pre-COVID, which could reflect again our increased use of e-commerce, but also shows what's happening on our roadways as congestion and roadway traffic returns. So one of the other trends that we've looked at is how this is working with bike and ped on our streets as well. See if that's going to move forward. There we go. So serious injuries have grown less slowly, which again would account for having less vehicles on the street to interact with the bike and ped as those have increased. So again, we are looking at this injuries and crashes being less than what's happened in 2019, which would make sense. But unfortunately, you'll see in the next slide that fatalities have actually increased throughout the area. And again, this is only City of Chicago data, but it's important to know that this is what we're seeing with our peers in other cities are also seeing that while some of the crashes and injuries are reducing, the fatalities in bike ped is increasing, which is an important piece for us to note, and could also correlate to the speeds of drivers increasing with less traffic volume. So again, something that we've been monitoring and looking at. Another trend that we're following and very concerned about is obviously the transit ridership. It's significantly declined, as we all know. This information is just in August, so it had a deeper decrease in ridership earlier in the stay-at-home order. We're seeing some transit ridership return, but it's still down over 60%. There is a lot of information on this on the RTA website, but wanted to take a moment to look at this decline in ridership because it raises a lot of questions for us, again, as the planning organization and trying to still meet the goals of our region's 2050 plan, that the decline in transit ridership is also connected to congestion on our roadways, air quality on our roadways, funding for how the system will continue to move. So these are all questions that we really have to ask ourselves in the region of how we're going to continue to reach our 2050 goals with transit ridership significantly declined. Another trend that CMAP has been following and looking at was how people are moving around the region and how we saw disparities in who was moving around the region. We did some early work during the COVID stay-at-home order about essential workers, and we're starting to see that that's slightly changing. You see the blue line at the top shows the lower income travelers versus higher income travelers in the other colors. People with lower incomes continued to move around the region in a greater degree. Again, they had jobs classified as essential. These differences are really lessening between phase 3 and phase 4, and we're seeing the different types of commuters, movers moving around in similar ways. So when we think about essential workers and how people are moving, that takes us kind of into the business commute. And so we start, again, asking the questions of how are people going to return to work? Will there be a return to work? What does telecommuting look like? And again, as we talked about transit, what is the future of the central business district as in our hub and spoke system of transit? And so what we're starting to pull information from is within the Chicago Recovery Task Force, worked with the Chicagoland Chamber earlier this summer to survey their businesses. And as we expected, approximately 60% of their employees used transit pre-COVID to get to work. But what are they going to do now? So we understand that less than half of the respondents to that survey indicated that they plan to bring all their employees back to work by 2021, and only 1/3 of the large businesses plan to do so. And then they're going to offer some different things like alternative employee days and shift working hours to earlier or later in the time to be able to address that. Since then, we've also had information from Cranes doing their own survey, and I've had several conversations with many of our partners with the Chicagoland Chamber and their employees. So how to better address, again, transit and transportation as we start to look at an equitable recovery. One of the things that we knew, again, as being the region's metropolitan planning organization, is that we really needed to look at this as a shared strategy throughout the region. We couldn't do it in silos, and we couldn't do it, city by city, county by county, because our region moves as one. The set of charts that I'm going to be showing show a flow of residents from their home, which is on the left, to their workplace is on the right. I don't expect anybody on the call to be able to see all of these colors and understand where all the lines are going. I'll kind of go through that just to show some of the themes that we're seeing. And it's also important to note that we have created a video online so that people can understand how this is working and explains the different flows and actually shows more than what I'm going to show today. So if you're interested in really dissecting this graph and how people are moving, I definitely point you in the direction of that video. So what we know when we think about the region moving is that 48% of our residents in the region commute within their own county or within the city of Chicago. But on the flip side, that means that more than half of the workers living in the region are commuting to different counties or going to the city of Chicago for their jobs. So again, we're moving in the region. And I know we strive to build places where residents can live and work and play. The bulk of the economic activity increasingly happens at a regional level, which also shows that we have a single unified labor market. So I want to point out a few other commute patterns. If we start by looking at suburban Cook County and the Collar County, so we've taken the city of Chicago off of this graph, you'll see a great deal of the commute flows are occurring outside of the city of Chicago. So still a significant amount of people are moving. In fact, 57% of the workers living in the region commute among Cook County and the Collar counties. So now we're going to take a quick look at the commute between Chicago and the suburbs. So if you add Chicago back in and just look at where they're commuting, in total about 24% of workers in the region move between the city of Chicago and the suburbs. 14% of the workers in the region live outside of the Chicago area or city of Chicago, but commute into the city for their job. And as the graph shows, the largest number of these workers come from suburban Cook County. But it's important to note that all of the counties in the region have residents that work in the city of Chicago. And in addition, it's important to note that about 10% make the reverse commute, city of Chicago, out into the suburbs. So again, the data shows that we are moving as a region and we need to address any of the solutions after COVID as a region. The other thing that we looked at when we think about all these people moving is what if we started hearing anecdotally that people are like, well, I'll just drive. If that's how I have to get to work, I won't get on transit. I'm just going to drive. And so we started to take a look, well, what happens with all those commuters if it was pre-COVID and we hit those levels again and we start to go back to work? If only 1 in 4 people start to move to their cars versus transit. And it's significant to know that it's not just the commute into the central business district that would be affected. You can see that the increase in hours happen throughout the region with some different examples here of regional areas moving around. The staff looked again at those different levels and were able to calculate that drivers would spend 193,000 extra hours on the road each day, which would equate to $1.2 billion lost annually in productivity. So the idea that our transit system, that we can step away or ignore our transit system is something that is perplexing for us and something that we definitely know we need to have the transit system rebound in order to, one, not have to deal with the congestion on our roadways, but also to meet for CMAP our goals of 2050. Again, looking at air quality and quality of life and things that we really, and resilience in the 2050 plan. So here at CMAP, we just recently launched our mobility recovery work. How do we look at our goals in 2050 in this new reality? How do we take this opportunity to reach those goals through this new lens? So we're bringing on a consulting team to work with the staff to support an equitable recovery from the COVID-19 crisis. This work will mitigate a likely rebound in congestion, which we just discussed, sustaining the transit system, and increasing the resiliency of our region's multimodal transportation system, bike, ped, other alternative forms of transportation. So the primary objective of our project is to develop a mobility action plan. This would give our regional leaders and stakeholders a chance for public engagement and chance to weigh in, as well as different programmatic changes for implementers at our local, regional, state, federal levels to carry out. It will also complement the work that we did in 2050 and support our update to the plan, which will occur in 2022. I'd lastly note that one of CMAP's core values is to drive innovation, and this is an opportunity to do this for our region while we're staying the course in the goals that the On to 2050 plan set for our region. And I will turn it back over to Nick to introduce our next presenters.
Thank you so much, Laura. Our next panelist, Jamie Simone, is the Deputy Director for Strategic Initiatives at the Chicago Department of Transportation. In this role, Jamie leads strategic planning for the department, as well as coordinating the city's transportation-related COVID response. Previous to CDOT, Jamie held roles at Sam Schwartz, the Illinois Department of Transportation, and at the Trust for Public Land. Jamie?
Thanks, Nick. Thanks for having me today. And I think the next slide should be coming up. Great, thank you. So I wanted to start with this picture for two reasons. First, I know our topic today is about transit, and for most people that means CTA, buses and trains, Metra and PACE. But for us as the Chicago Department of Transportation, transit is those things, but we also consider transit supportive modes of travel, like biking and walking, for example, and other micromobility services like Divvy, our bike share system, and the e-scooter pilot, which we have going again this summer, and anything else that might come in the future. A strong transportation and transit system provides people with options, and those options, many of those you see in this picture, are critical to our economic recovery as people consider ways to get to and from work, as Laura was just describing. But I also wanted to start with this picture because it's a reminder of what our city looked like before COVID. It's hard to imagine all that activity, but this is what our city used to look like. On the next slide, you'll see another image of our city. This is from March and April, and this is what it looked like on Michigan Avenue with a coyote on the loose. It's also hard to imagine. And as you can see in this picture, although there's plenty of space for people to walk and bike and maintain their 6 feet of social distance from each other, this wasn't the case in all neighborhoods. With so many people working from home, with school not in session, with the weather getting nicer, lots of people were out and about walking around their neighborhoods, since this was one of the only allowable activities we could do during the stay-at-home order. In fact, in many of Chicago's neighborhoods, residents were having to walk in the street because they didn't feel safe on the sidewalk being too close to other people, which is not an ideal situation, having people walk in the street. Other cities too were under stay-at-home orders and were experiencing the same issues of crowded sidewalks. On the next slide, you'll see 3 headlines from different cities announcing plans for closing streets or opening them, depending on how you see it. And here in Chicago, we call them shared streets, so that people have more space to walk and bike and maintain distance from each other. So these headlines from left to right are from March 27th in Minneapolis, April 10th from Oakland, and then the New York Times article from April 11th, which talks about Minneapolis, Oakland, and Boston starting their open streets or closed streets programs. We wanted to do things differently with input from communities. In most of these other cities, the decision to open or close the streets was made without any impact, or excuse me, any feedback from the residents. And we wanted to get input from communities before we launched any kind of program. We also recognized that this issue of crowded sidewalks and not enough space to walk was not universal throughout the city. And in conversation with some of our advocacy partners, we knew that different communities needed different things to get them through the pandemic, and that there was no one-size-fits-all solution. So in early May, we launched a survey, which you'll see on the next slide. It asks 4 simple questions about your experience getting around during COVID. And we've had over 2,000 responses to the survey. So the maps you see here are the results to date of the survey. They're also on our website. The rectangular shapes that you see on each of the maps are the outline of the zip code boundaries within the city. The map on the right shows you how many people we've heard from in each zip code. And the map on the left shows you the most common topic that people highlighted or talked about in the survey, again, by zip code. So to illustrate my previous point about how not every neighborhood needs the same thing, you'll see some differences. Like, for example, on the southwest side, the most colorful area of the map there, you'll see things like biking, walking, and speeding are the things that people thought were most important. On the south side, the east side, you'll see that blue color, that bike infrastructure was the most important. And then you'll also see the majority of zip codes on the north side expressed interest in shared streets. And so with this information and with input from aldermen and others, we launched our shared streets program. On the next slide, you'll see an example of a street that is a shared street. I believe this is Drexel. This is, if you haven't seen it, this is considered a partial closure, but you know, the barriers are there to limit vehicular access and to prioritize people biking, people walking on rollerblades, etc. So as a partial closure with local access only, that means you can still drive and park in front of your house, you can still get deliveries, but again, as I said, we're prioritizing the movement of people to allow more space within the right of way so that they can maintain distance from one another. On the next slide, we also started up a survey, this is also available on our website, for people to evaluate the Shared Streets program. There are 9 shared streets currently, and 2 more are in the works. There might be one this Friday, hopefully there'll be another one next week. We've had over 1,700 people respond to the evaluation survey, 900 of those in the last month. And you can see from the pie charts on the left, close to 75% want to see more shared streets this year, and about the same percentage want to see us do the program again next year. And on the right, you can see the reasons why. People like having more space in their neighborhoods without cars so they can get around on foot, on bike, etc. On the next slide, we also worked closely with other city departments to launch our expanded outdoor dining program. Here are 2 examples. It's been very successful. Over 300 restaurants are now participating in that program to offer outdoor dining, which keeps the businesses afloat and also got people back to work. And just this week, we announced some guidelines to allow people to, the businesses to extend the expanded outdoor dining program into the colder weather, which is something new this year. And we'll continue to work with businesses to see what we can do to support them staying open safely into the colder months and into the spring. Earlier this summer, we also launched a massive expansion to our Divvy Bike Share program. So in the maps on the next slide, you'll see on the right, the maps on the left, but in the right part of the map, you'll see the white part with those blue dots. That was the existing system. And then what you see in blue, gray, and red is the phased expansion of the program, which will bring Divvy bikes to every corner of the city. Again, as I said earlier, more options for people to get around. If you've been out and about this summer and noticed more people on Divvy bikes like I have, you aren't dreaming. If you go to the next slide, you'll see a Twitter post that we put up that August saw the highest Divvy ridership since the system began in 2013. Just a note about this bike that you see here in this picture, the black Divvy bikes are e-bikes. That's also a new feature of the system. E-bikes have a battery built into them that give you a little bit more power. It's like an electric assist. It gives you a little bit more power in your pedaling, which are really great for longer rides. And so again, thinking about options and thinking about people getting back to work and some of the longer commutes people have to make, e-bikes are a really good opportunity for people to make a longer trip that maybe isn't as easy on transit, or they don't want to get on transit. With that e-assist, you can go farther without having to use so much energy, so you can just get a little bit further without it being so difficult. We've also been doing other work downtown and in this area surrounding downtown. So in this slide, you'll see, this is Dearborn, where we've added high visibility paint to the bike lane on the left there and the bus lane on the right. And we've also been repainting crosswalks and bike lanes. And for those of you who have traveled downtown, maybe you've noticed. If you haven't been downtown, you will notice that there's a lot of new paint on the roads, again, to help support the safe movement of all modes of traffic as the city begins to recover from the pandemic. Lastly, this week we launched pop-up bus lanes to support faster and more reliable trips on some key routes. And I think it's important to note that not everyone had the luxury of working from home during the pandemic. And as Laura was mentioning, lots of people continued to work in their essential jobs, and lots of those people who commute to essential jobs do so on buses and trains. In fact, while ridership was down in the city overall, certain bus lines did not experience that same decline in ridership because they connected people to these essential jobs. Two of those such routes are 79th Street and Chicago Avenue, and those are the first two where we'll be doing these pop-up bus lanes, again, to support a quicker, more reliable commute on bus. If you'll click one more time, this is an article from El País in Spain. This, I think, was published last week. And it's an article about people's fear taking transit. And if you'll click one more time, these are some quotes that I pulled from the article showing that Spain, Japan, France, Switzerland, there was another paragraph about China. None of these places in the studies have associated any of COVID outbreaks with people riding transit. So in Spain, not a single outbreak was associated with subway, train, or bus. In Japan, in May, their hotspots mostly occurred from gyms, bars, concerts, karaoke clubs, restaurants, not public transit. In France, the 1,100 outbreaks that they had between May and August, only 1% of those cases were linked to buses, subways, and trams. Switzerland, same thing, 800 infection hotspots in August, and none of them were related to transit. And like I said, there was another paragraph about China. It was a little bit more detailed. Same idea, though. So I leave you with that as a final thought. That again, our role as the Department of Transportation is to think about giving people options, which is what we've been doing all summer, which is what we've always been doing, and we will continue to do. And I hope that this message that transit is safe will be spread and will bring people comfort as they return to work. And with that, I'll turn it back over to Nick. Thank you.
Thank you, Jamie. Our last panelist is Heidy Persaud. Heidy brings to our discussion a multidisciplinary and equitable focus as the Center for Neighborhood Technology's Director of the Transportation Equity Network. Prior to CNT, Heidy worked in urban planning and community development at Tesca Associates, CMAP, and the Chicago Transit Authority, providing expertise to communities across the Chicago metropolitan area. Welcome, Heidy.
All right, welcome. Thank you. Sorry, guys, while I navigate webinar here. So good morning, all. My name is Heidy Persaud, as Nick mentioned, Director of Transportation Equity at the Center for Neighborhood Technology, or CNT. Thank you for having me, CMAP. For those unfamiliar, I'd like to just start by saying that CNT is a nonprofit that is working to advance urban sustainability and shared prosperity through transportation, water, climate, and public policy. And we're currently overseeing the region's first transportation equity network, which is significantly contributing to the ongoing conversations around travel safety and COVID-19 impacts, which I will cover now. So what are some of the benefits of incorporating community-based organizations into COVID planning and preparation, or current efforts? One of CNT's newest initiatives, the Transportation Equity Network, which I will refer to as TEN, is a coalition of community groups, equitable transportation advocates, civic organizations, and other stakeholders in Chicago and suburban Cook County who work with decision makers to embed racial equity and mobility justice into transportation plans and projects. 10 participating community-based organizations, which I will also abbreviate to CBOs, represent the needs of people in Chicago and Cook County that have suffered from inequitable transportation access or have been negatively impacted by past decisions by transit agencies or the city government. A side note, if you're wondering, the CBOs that we're working with are compensated for their work and their participation through the use of several grants and contracts. But back to the slide here. What are the benefits of incorporating CBOs? They are critical partners for developing plans and implementing projects. And although they haven't always been seen as partners, as traditional partners of the government and transit agencies, they are key in understanding communities. They are key in providing sustainable solutions, as CBO leaders often outlast our elected officials in their communities and can sometimes provide support for plan recommendations while surviving electoral changes. So in terms of just sustainability and being able to have a consistent voice in the community, you want to make sure that you are creating strong connections with your community-based organizations. They also represent the interests of those who live in their neighborhoods, those who we consider to be the most vulnerable or underrepresented residents, particularly in traditional planning processes. And in this case specifically, many of those residents are those that we have termed essential workers during the pandemic. Okay, next slide, please. Thank you. So before we jump into the use of mobility, 10 participants have emphasized that engaging them in conversations around COVID planning and recovery should at the very least acknowledge history and make a concerted effort to improve coordination and outreach efforts to aid in building trust in a lot of these communities that have been negatively impacted by transportation and policy decisions. It's imperative to acknowledge that the pandemic disproportionately harmed marginalized communities that were already facing many unfavorable conditions, particularly with transportation connections. In addition, communities can better identify comprehensive recovery efforts since they best know their residents and should be involved at all levels of planning. Next slide, please. As mentioned earlier, many essential workers and riders hail from under-resourced communities that heavily rely on public transit. They continued using transit during the pandemic and will always use public transportation, primarily because of their historic and socioeconomic status. During the pandemic, the subset of the workforce that kept the transit moving, many of those being the ones that work in the warehouses that were fulfilling the orders that we, those that had the privilege of working from home, were and still are ordering from. As Laura mentioned, the uptick in e-commerce that we're still seeing. They were the ones that were continuing to take public transit and risking their health and livelihood. And also many of these residents are frontline workers. They were the ones driving the buses, conducting the trains, and continuing to risk their health when we were uncertain of how the disease was being transmitted. I just want to point that because Jamie mentioned that there's such a small percentage of infection rates that we're seeing on public transit, it's great to hear that, but I think at the beginning of the outbreak, no one really knew for certain. And so many of these essential workers were just risking everything and continuing to move transportation for the rest of us. So as ridership has plummeted during the pandemic, how will transit agencies make decisions on cutbacks? Many residents in marginalized communities were already facing a lack of good connectivity, and these can be aggravated by some of the difficult decisions being made about cuts in service. So will there be considerations for the essential workers that need to travel to job locations outside of the city center, outside of the loop? For those that require multiple transfers, whether it's within one mode or transferring from one mode to another? And who will be involved in these conversations? Will it be the essential workers or will it be the choice riders who traditionally dominate a lot of these conversations? Next slide, please. So safety factors that many of our 10 participants have shared over the past few months, I want to begin by saying may be perceived or real, but both are just as important and impact people's decisions to ride transit. You can look at it from two angles, one being at the stations and while on transit, which include some of the typical factors that I think we already know: lighting, shelters, visibility, cleanliness. And I think cleanliness in this case was particularly heightened because of COVID. But then there's also something that more folks are beginning to discuss these days, which is harassment, whether from other community members, other riders, and of course policing and the distrust in the current environment with the police. The other is accessing transit. which really points at accessing the stations and the bus stops. So we're really talking about considerations for disabled residents, disabled riders, which many live in a lot of those marginalized communities that we continue discussing. So are sidewalks connected, or are they missing? Are they broken? How dangerous are the intersections? As somebody, one of our participants from Andaleo, which is in Washington Heights in the south side of Chicago, mentioned, they built a beautiful station at the 95th Street station for the Red Line, but didn't consider the challenges that come with crossing 95th, and that it's actually just continues to be a concern, a legitimate concern for not just your average rider, but mothers while they're pushing strollers, people in wheelchairs, etc. Truck traffic is another one that I have here related with dangerous intersections, because while it is a traffic concern, it is also an air pollution concern. So we're looking at safety in terms of health, and whether or not levels of air quality are safe for the residents that are living in these communities. And of course, we have lighting and visibility, route schedule and availability, seeing as many of these essential workers didn't work during your typical rush hours, and how often trains and buses were running. And then, of course, to bring it again into the conversation, this issue around harassment and policing, which we're seeing a lot these days. Next slide, please. And lastly, and related, the city of Chicago has released its new policy plan for eTOD, which looks at incorporating equity into building TODs, particularly in the south and west sides of the city, when I think historically about 90% of TODs we're seeing primarily on the north and northwest side of the city. So this policy, which was derived by a group of city departments and agencies, civic organizations, and other advocates and leaders, devised what is being considered the first plan of its kind in an American city, and really looks at bringing equitable transit-oriented developments to provide residents in the south and west side more opportunities to walk, and to walk safely, to access their jobs, to go shopping, to get to daycare and other daily needs. The plan recommendations will fall under three major categories. One is building the capacity for the city for eTOD, which will leverage their publicly owned vacant land near the transit, making eTOD required, easier, and more equitable through the creation of an overlay zoning district, and embedding eTOD into the city's upcoming citywide plan, We Will Chicago, by conducting a racial equity assessment on land use and zoning. And so this concludes my presentation. Back to you, Nick. Thank you.
Well, thank you very much, Heidi. Well, now we are going to move into our question portion, and we already have some great questions submitted. And if you have any that you'd like to add to that, please go ahead and submit those questions. We really want to focus on the questions that you have for our panelists, although I do have a few prepared ones that can help get us going as well, and address some potential topics. But the first one is just looking, really generally at the topic of public transit, and I think we all kind of agree that that's going to be key to making sure that we don't see a significant congestion surge as people return to work from COVID. So what can be done to get people back onto public transportation? I know we've heard from a couple of our panelists about the safety concerns and what the data really show as far as whether transit is a source of spread for COVID, and how much of a concern that needs to be. But obviously there's other reasons why people choose public transportation or choose not to take public transportation even before COVID. And I'll throw in that AAA actually did a survey of our members about a year ago, looking towards the congestion issue and asking of those who work in the loop and don't take public transit, choose to drive instead, what are some of the reasons? And the top two reasons really just had to do with the placement of train stops and the schedule, knowing that even with congestion on the interstates and the expressways, that it was still faster for them just because of where they would have to go to catch the train and what the schedule for that train was. And knowing that we have reduced schedules on much of the metro network, at least still, that almost kind of exacerbates that because there's even fewer trains and it may be even more problematic for people's schedules. So how do we address that, kind of the chicken and the egg? How do we get people back onto public transit enough that we can add the full schedule back in, which will make it more convenient for even more people to take it then too? And this one isn't directed to any one particular panelist, so if anyone wants to jump in and weigh in on that.
Well, I'll add one piece to this, and then maybe Jamie and Heidi can talk a little bit as well. I mean, I'll start with just by saying that, like you said, Nick, with the chicken and the egg, one of the big concerns as we look at the transit system in general, right, is that luckily we were able to get some federal CARES funding so that we can keep the transit system going for the next year. But like you said, the chicken and the egg is the transit agencies are kind of two pieces of leverage, right? Is if ridership stays in a decline, that they either reduce fare, they can either increase fares or reduce service, and both of those would be inequitable hits to, again, the people we're talking about with essential workers and non-choice. And additionally, just as a public service for people to be able to move around our region. So we really want to be able to look at what other things can we look at in order to sustain the transit system in general. So that's kind of the big picture piece, right? I think, and any of us can address, and I would definitely point people to the different websites as well, as that the two pieces being the trust of the service itself, and then the trust of other people. And I think Jamie got to that a little in her comments. The trust in the service and the cleanliness of the service, I think that the transit, the service boards right now are doing an amazing job trying to, I've said it, I tell my friends and family, right, the trains and buses have never been cleaner ever. So this is the moment, right, if you were going to ride on transit, that they are doing an amazing job in cleaning all of their facilities. I think the flip side is, are people going to trust other people on the transit service? And that is the space that I think we're going to spend a lot of time trying to work out, with information of how many people are on a bus, how many people are on a train, so that people have the comfort level of who they're interacting with. And that is the space that I think we're really starting to get into right now, is how do we create confidence in people wearing masks on the train and on buses, because and the distancing that you would have there. And I'll hand it over to Jamie and Heidi for some more.
Yeah, I would just add that in that article that I put up, the two factors that they said contributed to safety on transit were people wearing masks and the ventilation system on the transit vehicle, whether that was a bus or a train. So Laura, I think you're exactly right, that it's both of those things working together that make it physically safe, but that, you know, the individual riders have a responsibility to wear their masks, and the transit provider has a responsibility to keep the systems up and running clean. And I also would add that, again, I'm back to these options, but I think it's about getting people back on transit, but it's also about keeping people out of their cars. So as a Department of Transportation, it's our responsibility to make sure that the crosswalks are painted, the bike lanes are painted, and that we're doing things like these pop-up bus lanes, which is transit related, to make it easier for people to choose other forms of transportation, so that we don't see a resurgence in cars more than we already are. What I think is amazing is that we're already back up to 90% of pre-COVID traffic levels, and yet when you go downtown, again, we're just talking about commutes downtown, it's like a ghost town. There's hardly anybody there. So that we're already back to those levels, and so few people have returned to work, I think is not a good sign for us.
Yeah, thanks. I think I just want to start by saying that I continue to bring up the 10 network because I think that they are just such a treasured resource for these conversations. And they just bring the point of view that just really needs to be at the table. And so as we're discussing, what is it going to take to get back onto transit? There's a couple of things that have came up during a lot of these conversations. Of course, everyone is saying, well, we need to make it more welcoming. What does welcoming mean? And of course, there's the cleanliness and safety aspect. And in the words of a youth council member from the Northwest Side Housing Center, he said, hey, I didn't take the diversity bus before the pandemic because it was so dirty and packed. And he said, and I won't take it for another 6 months. I'm going to ask for a ride or I'll just walk wherever I'm going. That's how strongly he felt about just returning back to transit. So I think there's going to have to definitely be a push in whether it's education and communicating some of these efforts that you mentioned, Jamie, and making sure that people really know that it is safe and it is cleaner than ever to ride the buses. I think another thing is going to be efficiency. You just cannot beat saving somebody time. And so we know a lot of these folks that are taking transfers or are stuck in traffic on the bus just don't find the benefit to riding buses or trains, I suppose, and they'd rather walk or get a ride. And so I think the conversation around BRTs might become even more important. And I was happy to see the city of Chicago's announcement recently for that BRT, I believe, along Chicago Avenue. Maybe you know a little bit more, Jamie, which I think would definitely be a step in the right direction for getting people to get back onto the buses at the very least.
Nick, you're muted.
Thank you, Jamie. Another question I think that ties right in with this is the question of challenges that the transit system was facing even before the pandemic. One of them was the rise of rideshare and you know the shift of people from transit into rideshare, and I certainly think that the pandemic has accelerated that as well. So what trends are we hearing in terms of how we can navigate that relationship between transit and rideshare? And has there been any research done on ridership within the rideshare networks during the shutdowns during the pandemic?
Jamie, do you want to take that one?
Yeah, I don't have the numbers for ridership. You know, I've anecdotally noticed more people taking Ubers now than I did, you know, at the beginning of the pandemic. But this is a consistent issue, both in terms of congestion and in terms of its impact on transit ridership. You know, I think when we get to the point where TNCs reduce individual car ownership, then we'll start to see a shift in congestion. But right now it's just an addition. And so I suppose on the one hand, it's a good option for people who aren't feeling safe traveling in other ways, but at the same time, it's definitely going to contribute to further congestion in the region. And unfortunately, I'm sorry, I don't have any numbers on that. Laura, I don't know if you have regional numbers for TNCs.
Yeah, I was going to follow up. So I think, like Jamie, we have, and at CMAP, we crave data. We do a lot of work with data. And so we are still waiting for more recent data of the use by rideshare. So that's something we're, you know, waiting for very anxiously. I will say that we just released My Daily Travel, which is a survey that we did pre-COVID, but does give some insights of who is using rideshare and, you know, by areas of the city, by age. And there's some really interesting data there telling us who's choosing to use it. And again, there's a lot of areas where people don't have good transit accessibility that are using rideshare instead of, and that's something, again, we have to look at for accessibility, as Heidi talked about, that we want transit to be accessible and easy to get to throughout the region. So that shared some gives us some information pre-COVID, but we're still anxiously awaiting data for what's happening right now during COVID.
Heidi, did you have anything to add on that question? Also another one that I think kind of dovetails nicely in this. Has the pandemic clarified any unmet mobility needs for population which is reliant upon transit to get to and from work? And what is being done to ensure that this critical and reliant population receives the mobility they need?
Could you repeat the first part of that question, Nick?
Sure. Has the pandemic clarified any unmet mobility needs within the population? Folks who rely on transit to get to and from work, and maybe are either unable to do so or still leery to do so, and exposing any gaps in what their needs are when transit isn't an option for them.
I mean, yeah, it definitely, I think, exposed what was already a kind of a system that didn't quite work for everyone, particularly in the city. When you speak to the residents on the south and west sides, there was already concerns with lack of connectivity to, again, anybody that wasn't traveling to the loop, people that didn't ride during rush hours, folks with accessibility concerns. And so definitely, I think that when COVID hits and issues of safety and cleanliness kind of came to the forefront, all of that was just exacerbated. I think it only sort of confirmed what we already knew and what we had already been discussing.
Another question, and this is actually this is one of my questions. Thinking about the changes that we've seen so far and the shifts of modes of transportation, particularly from vehicle travel to active modes of transportation like bike and pedestrian walking. This is obviously all taken place so far in the context of some really beautiful weather that we've had over the last 6 months, and that obviously is going to be changing in the next several weeks or months, depending on how long of a fall we get to have this year. But what will the impending winter potentially do to change the dynamic and exacerbate or alleviate any of the dynamics that we've been seeing so far?
Well, I think it will be a challenge. I know personally, as an anecdote, when I have had to go into the office, I've been riding my bike, and luckily it's been beautiful. There's been very little rain. I'm not a cold weather cyclist, so when the weather turns or if it's stormy, I have to think about how I'm going to get to work. And I live not far from transit, and so that would be an option for me. But I do think that that's a concern. And again, to the extent that we can not only provide the infrastructure for people to continue to walk and bike and take divvy as they have been, I think there's also, as was mentioned earlier, a communications component and an education component. So there are people who bike all winter long, and they will tell you it's not that big of a deal, actually. You just need to layer up and get the right gear and you're fine. So I think that's something that we hope to grow into from a communications perspective, is helping people figure out what that means, what it means to bike in the winter, what you need to do to prepare to bike in the winter. We've even had, we have safe ambassadors that work for CDOT, and they've been doing group rides to help people feel more comfortable biking, even in good weather. But if you've never biked to work before living in the city, doing that for the first time can feel intimidating. So trying to remove those barriers, and if you bike with someone who's a veteran cyclist, and if they show you the tricks for the route and what's the best route to take and how to navigate tricky intersections and what to look out for, it can make it that much easier. So there's nothing we can do about winter, but we can try and change our mindset and make it more comfortable for people and help do things to remove barriers so that people continue to to use active transportation if they're not comfortable getting back on buses and trains to avoid taking their cars.
I will just add in, I echo everything that Jamie said, and I think that, as we start to look towards, again, the trends of congestion on our roadways increasing, we've also seen the trend of used car sales going up in the United States. People who maybe wouldn't have used a car before and have used other active transportation or transit are making that choice, and that definitely, as Jamie said, concerns us. Because the impact of what's going to happen to quality of life, down to the use of pavement on our roads, right? The cost is gonna go up for us to deal with transportation. So there's a whole gamut of things, air quality again, that concern us about the impacts to our region. So we really want to be able to look at how do we make those active transportation options throughout the whole region, not just in some of the city of Chicago, but through, again, many of our suburbs, that still retains its attractiveness to people. So it's something, again, we're going to have to keep working on.
Yeah, I agree with both Jamie and Laura, and I just would add that, as mentioned in the presentation, this is the time to really just prioritize outreach, particularly to those communities that you may not have a clear, definitive answer on how to go about approaching the changing situations, but they are the best experts at their communities and what will truly inspire them to get back onto transit and continue to engage in active transit, like biking and walking, particularly when the weather changes or when situations or the environment may feel a little bit less safe to do so. So just making that part of the planning process right from the beginning. You just can't go wrong with talking to people.
And I think we have time for one more question before we need to wrap up, and it's one that's really near and dear to AAA's heart, and that's safety on the system. We've seen, even with the decline in roadway travel, at the height of the pandemic, we still didn't see a significant reduction in fatalities and crashes, as the data that was shared earlier showed. So what are the things that you're looking out for as we build back traffic and people return to the roads in terms of traffic safety, and what are your agencies doing about that? I know AAA is very concerned about the fact that the return to work is also coinciding with the escalation of illegal marijuana sales in Illinois, and this is our first year of people having access to legal marijuana at the time when they're now getting back on the road, and we've been trying to work with our stakeholders and traffic safety partners on that. But what are some of the other issues that are out there that are of concern to you, and how do you hope to address that?
Well, I can start just by saying that CMAP has currently launching our safety action agenda as well for the region. We're going to take some lessons learned and best practices from the city launching their Vision Zero work, and how do we expand that through the region so that all of our residents in Northeastern Illinois can see the benefits of improvement in safety. Additionally, we want to look at some speed issues, complete streets and things like that. So we've actually hired someone specifically to focus on safety at a regional level. So that's some of the movement that CMAP's making.
Heidi, were you gonna say something?
You can go ahead.
Okay. So yes, I mean, it's a huge concern, especially when you see pedestrian and bike fatalities have not gone down in the way that they should, given the reduction in traffic volumes. And as Laura said, I'm sure that speed is a factor. It's the #1 contributing factor to whether a crash will be fatal or not. So if congestion goes up, speeds go down, and hopefully naturally the fatalities will go down. But with more cars on the road, there's more conflict. So, again, our role is maintaining and providing the appropriate infrastructure to keep people safe. And we do that all over the city, of course. And we also have a Vision Zero plan with steps towards getting to 0 deaths on our roadways. And it's the things that Laura was mentioning, complete streets design, which prioritize the most vulnerable road users, pedestrian, cyclists, pedestrian, including people walking to and from transit. It's about, the simple design things like narrower traffic lanes, which help people slow down, and designing roadways so that people are encouraged to drive more slowly. There are other things you can do in pedestrian corridors to provide more space for people to be when they're walking, to shorten crosswalks. So there are some tools that way. And then again, as we've said before, education. People need to understand, I think they do fundamentally, but it needs to be more in the forefront that when you get behind the wheel of a car, it's an immense responsibility. You're at the helm of a several ton vehicle that are bigger and heavier than they've ever been in the past. And looking away for even a second or responding to a text or looking at your phone could cause a death. And I don't think anyone wants to be responsible for that. So it's a combination of engineering solutions, education, and providing what people need to stay safe in the roadway.
Totally agree. And just to drive the point home, engaging folks at the design level as well would definitely benefit the process, particularly when we're talking about what needs to be considered for a street to feel complete.
Wonderful. Well, thank you all for your remarks on that and your panelist presentations. Very informative. I think this is a conversation that's going to continue to play out over the next several months. Thank you for joining us today. To all of our participants, please remember to complete the survey. And if you joined our webinar, please join us next week for a conversation that CMAP is hosting with Cook County Forest Preserve, and the link to register is there in the chat box. So thank you so much, everyone, and have a good, safe rest of your day.
Thank you.
Thanks, Nick. Thanks, Jamie and Heidi.